you for being with us this morning. This morning, we will have a presenter, Dr. Villalobos from UTRGV, who's going to be presenting on psychosis. So just to let everyone know that our session will be recorded and we will be putting it up on our website. So welcome, Dr. Villalobos, and the floor is yours.
Good morning, everyone. I hope you can all see my screen. I'm sharing some slides for you to help facilitate the information that I'll be going over with you today. Everybody see them?
Yes.
Oh, perfect. All right. So yes, today I'll be talking a bit about psychosis and the main things that we want to look for and recognize when somebody is experiencing an episode of psychosis. That is one of the number one reasons why there's usually a delay in treatment, is that many individuals find it difficult to spot these signs and symptoms or are unaware what to look for in someone who's experiencing a first episode of psychosis. And there's a lot of stigma, maybe things that we are unclear about how long it lasts, or individuals' perceptions of the consequences of having psychosis. So I hope to clear up a little bit of, about that and help you have some greater understanding of how to help a loved one or a student in your cases who might be experiencing psychosis. So in order to understand what it is, I'd like to start with a case example. So I want you to imagine this is an individual that you might come across in your personal life, or might know a loved one who's experienced something similar. But we're going to talk about Daniel. And Daniel is a 20-year-old college student. He started feeling very stressed about school and his performance in school, and ended up not being able to sleep for several days at a time. He's become withdrawn and paranoid, believing people are out to get him. One night, his roommate finds him pacing around the room, talking to himself and looking scared. Daniel's words don't make sense, and he seems very upset. He starts to believe his classmates are working together, that they're sabotaging him to make him fail his classes, and he hears voices insulting him. Even when his roommate tries to calm him, he gets more upset. Concerned, his roommate calls 911. Daniel is admitted to the hospital where he receives medication. With time and treatment, his symptoms gradually improve, but managing his condition and helping Daniel go back to school is proving to be a little difficult for him and his family. So, what are some things that might stand out to you about this case example? What are some signs and symptoms?
Not being able to sleep.
Yeah. How are you looking at that? Maybe as a potential trigger?
Yes.
Something that might be contributing?
Mm-hmm.
Someone said in the chat, the withdrawal, the social isolation, some paranoid thoughts. He's hearing voices. Words are not making sense. These are all sometimes common signs and symptoms of psychosis. During a psychotic episode, a person's perception of reality can become distorted, and it can make it hard for them to think clearly. They might develop really strange ideas, or ideas that seem strange to everyone else. And they might be things that they really truly believe are happening to them. They might begin hallucinating, seeing or hearing things that aren't there, and have difficulty managing their emotions. That is one component that I think people sometimes forget about, is the emotional component too, not just hallucinations or beliefs that seem irrational to us. So what is psychosis? We can think about it as this disconnect or loss of contact with reality. In Daniel's case, he thought people were trying to harm him, and that his classmates they were out to get him. he was hearing voices that didn't exist or that other people couldn't hear. And we can also think about a significant change in a person's behavior or their routine. So they're doing things or differently from the way that they usually do. They may start to become very, extremely active, or on the other side, they can be very, seemingly tired or lethargic all the time, or lack energy. So you can see a wide range of different reactions, but there's still this significant change in their behavior. They may laugh inappropriately or become angry or upset without reason. And often these changes in behavior are associated with some of the symptoms that we've already talked about. For example, a person believing that they're in danger may call the police. So that might seem like a strange behavior to call the police when they're not in danger, but they are believing they are. Someone, for example, who believes he's Jesus Christ may spend the day preaching in the streets. A person may stop eating because they're concerned that their food is poisoned, or have trouble sleeping because they're scared. So some of these changes in their behaviors can be associated with the paranoid thoughts, or strange beliefs that they may have. And so in addition to the changed behavior, people can have changed feelings. How someone feels may change also for no apparent reason. They may feel strange or cut off from the world. They might have mood swings. Those are common. And they may feel unusually excited or depressed. So a person's emotions can also be dulled, and they may show less emotion to those around them. Very kind of flat when it comes to their emotions. So you can have a wide range of different reactions during psychosis. But what we find is that it's this disconnect or loss in connection to reality, and a significant change in their behavior or their feelings. So whatever they were like before, they're behaving and they're reacting emotionally in a different way. And I just want to remind y'all, we'll have questions or time for questions at the end. So if you do have any, please hold on to them. So we're going to continue talking about some signs of psychosis. Well, one of the main signs or symptoms are these false beliefs or delusions. We're going to talk a little bit more in depth about them. These are common. A false belief is an absurd or irrational idea that the person believes is real. And the person can be so convinced of the reality of the delusion that no amount of argument, no amount of you showing evidence against that belief or to prove it is wrong, no amount of that evidence or argument can keep them from believing that it's real. Right. They think somebody wants to harm them. For example, when they leave their house, they think someone is watching or following them. In serious cases, they even believe that their family is trying to hurt them by doing witchcraft or wanting to poison them. And sometimes they think that the devil might be following them, or they might think that they're receiving special messages from the television or radio or newspaper. These delusional beliefs can sometimes be difficult to spot, I think, because nowadays we have a lot of conspiracy theories around, right? And there are a lot of people believing there were chips in the COVID vaccine, and things like that can start permeating, people's general beliefs. And sometimes it can make it hard if someone was already, expressing some of those beliefs, to hear them talking maybe more and more about them, to seem very obsessed about them, to start, feeling scared that people are monitoring them. Then we kind of start to perk up our ears and think there might be something more serious happening. But for these reasons, there's a lot of conspiracy beliefs out there. It might be hard to spot someone going through delusions during an episode of psychosis. We've also got another main symptom, which is disorganized speech or confused thinking. Okay. The confused thinking kind of starts being expressed as disorganized speech. What I mean by this is that thoughts can become confused. Thoughts can become muddy or muddled for people with a serious mental illness. So what they say may not make sense all the time. And a lot of time they go from one idea to another without relating the ideas together. The person might have difficulty concentrating, following a conversation, or remembering things, and his or her mind may race. So they might have thoughts going quickly through their head, or they kind of can appear to be processing information very slowly. So again, you have a wide range of what it might look like, but generally speaking, their speech isn't making sense and their thoughts are not connected to one another in a logical way, in a coherent way that we can understand. One example that I have here is hearing somebody say something like this. Jaime is my friend, and the other day this cat scratched me, but I need to buy a vacuum to clean up the clouds. Did you know I like flowers? These thoughts are not connected to one another, and they don't make sense to us when we hear somebody speaking in this way, right? That's one example. And then a third main group of signs or symptoms are hallucinations. And we knew that in Daniel's case, he was hearing voices insulting him, right? So in psychosis, the person may see, hear, feel as in like touching or on their body, feel, smell, or taste something that is not actually there. For example, they may hear voices that no one else can hear, or see things that no one else can see. They may taste or smell something as if it was bad or poisoned, right? That someone else would not be able to smell. So the main types of hallucinations that people experience in psychosis are the visual hallucinations and the auditory hallucinations. So seeing and hearing things that other people can't see and hear. But again, there are other types of hallucinations too, like feeling things on their body or touching them, or smelling things, or tasting things that are not things that anyone else can taste. Okay. So when we think of, you know, coming across somebody who might be experiencing psychosis, we kind of ask ourselves, as mental health professionals or as people trying to help someone get assistance, we ask ourselves, are their beliefs flexible? So when that comes down to the delusions, are they able to see that what they were thinking or believing is not actually true? That there are no police following them, they're not being monitored, there are no cameras in the house? Or are they very rigid and they do not believe you no matter what evidence you show them? So we ask ourselves, are their beliefs flexible? We ask ourselves whether their experiences of these tastes and sounds and smells and things that they're seeing, are they connected with something actually in their environment? When they heard a cat meowing, there was actually, there are cats outside the house or that come to the house. So are they connected to something that is actually in the environment? Was the bad smell for the food they think is poison that actually the food was bad, it had gone bad? And then we ask ourselves whether their thoughts are making sense. Is what they're saying logical? Are their thoughts, understandable? Does the person, can they engage in normal communication with other people? And are their emotions in the normal range for what they usually are? Can they manage their emotions? And if any of these things is a concern, then we would say a more in-depth evaluation is needed for psychosis. So if they're having difficulties with any of these signs or symptoms, we need a more in-depth evaluation. Great. So who is affected by psychosis? And the truth is, anybody can experience an episode of psychosis. Female, male, no matter what age, ethnicity, race, anybody can experience psychosis or a psychotic episode. But the research also tells us that there are some people that are more vulnerable or where we see this happening more often. And psychosis or a psychotic episode is most likely to occur in young adults. Around 3 out of 100 young people will experience a psychotic episode. Males tend to experience psychotic symptoms or psychotic episode younger than females. So for males, we start to see these symptoms or signs happen in their late teens and their early 20s. Typically, that's what we typically see for psychosis. And for females, signs and symptoms of psychotic episode tend to occur in their early to mid-20s. So just a little bit later than males, and males at a younger age. So maybe you might encounter an experience of a student maybe later in high school, a male student maybe later in high school, entering college, start to experience some of these psychotic symptoms. It's not that it's unlikely to happen outside of these ranges of ages, but this is what we often or most typically see. Okay. So what is a first episode psychosis? What is first episode psychosis? This is the first time someone experiences psychotic symptoms or a psychotic episode. So you'll see this phrase often when it comes to finding treatment. First episode psychosis. People during a psychotic episode may not understand what is happening, right? Their symptoms can be very disturbing and unfamiliar, and that can leave them feeling confused and very distressed or upset. Do you remember in Daniel's case, even though his roommate was trying to calm him down, he would continue to get upset and distressed and scared. A psychotic episode tends to occur in 3 phases, and I'll go into more depth about what those phases are, but the length of each of these phases is different for every person. We have some idea of how long they might typically last, but there's no guarantee that every person will go through the same cycle and length of cycle as someone else. So the first phase is called the prodrome phase. This phase is where you see the early signs, and they can be vague and maybe hardly noticeable. You might not even notice the signs of psychosis. There may be changes in the way people describe their feelings, the way that they describe their thoughts and what they're sensing in the world, and they may become more difficult over time. But each person's experience will differ, and not everyone will experience the same symptoms. But let me give you some common ones. There's things like difficulty concentrating, having less motivation to do things. You can see people having depressed symptoms or depression, difficulties sleeping, anxiety, withdrawing socially or social isolation. People may start to express suspiciousness, and you might see their functioning or their ability to get around in life with their relationships, with work, with school, etc. They might be having difficulties in those areas of their life. And lastly, you might see some signs of strange beliefs or magical thinking. Okay. This phase can sometimes last several days to months, where you might see things that are a little bit below the radar, but small changes happening. The next phase is the active phase, or the acute phase, okay? The acute phase or the active phase is when the symptoms of psychosis have now emerged. It's also known as a really critical period, right? There are clear psychotic symptoms like hallucinations and delusions and confused thinking. And during this phase, the person experiencing psychosis can be really extremely upset and distressed by what is happening to them. They might behave in a way that is really out of character or out of normal to their family members, and can be really concerned, and their family members may want to start looking for help, right? Before this stage, the individual might have only been showing a gradual decline, a slow decline. And now it's really clear and evident there's a problem. This phase of the acute phase or the active phase can last sometimes at least a month, usually. The next and the last phase is the recovery phase, also called a residual phase. The recovery phase, with effective treatment, most people will recover from their first episode of psychosis. And they might never have an episode ever again after that first episode. It's important to remember that psychosis is treatable. There is treatment for it. And if it's treatment that is given early, an individual may never suffer another episode again. Initially, some of the symptoms that we're showing in the active phase may still be lingering in the recovery phase. So it's possible that their symptoms may decline or may be reduced, but they might still be lingering in the recovery phase. Some people will return to normal and live their everyday lives like they were before and recover successfully. And others will, again, have some of those lingering symptoms that they have to manage. The recovery phase can then take several weeks to decades or years and years. Depends on the person and whether or not they receive treatment early. Okay, so this is what we're talking about when we're talking about first episode psychosis. And someone is asking in the chat if psychosis can be caused by trauma. And if yes, can there be treatment before the psychosis happens? So we will certainly talk about the options and what can cause psychosis. And yes, trauma is one event that can put somebody at risk of psychosis. So I'm glad you asked that question. That's a great segue into what causes it. And so this is our general understanding from research is that usually people develop psychosis as a result of a very complex combination of having genetic risk or it running in families and being vulnerable to developing psychosis, plus differences in brain development and exposure to stress or stressors like trauma. Okay, so it's the combination of all those things that put somebody at the greatest risk of developing psychosis. Psychosis can also be a symptom of another mental illness like schizophrenia. It can be a symptom of bipolar disorder. Psychosis can happen also for people who are experiencing very severe depression. So a psychotic episode can happen within another mental health disorder. But a person can still experience psychosis and never be diagnosed with schizophrenia, never be diagnosed with any other disorder. So that can also happen. For older adults, psychotic symptoms can be part of a physical or a mental illness that emerges later in life. So we already said, psychosis or psychotic episode can happen to anybody. When it happens to older folks, it's usually because of a physical or mental illness later in life. Psychosis can also be a symptom of other diseases of older age, like Parkinson's disease, Alzheimer's disease, and some of the dementias. So psychotic episodes can happen under those circumstances too. Other possible causes of psychosis include sleep deprivation, someone who's not sleeping at all. It can include, it can be a part of, the side effects of certain prescription medications. Some medications can trigger a psychotic episode. And it can be the result of misuse of alcohol or drugs. That can also trigger psychotic episode. A mental illness like schizophrenia is usually diagnosed by making sure that it wasn't because of drugs, that it wasn't because of a medical condition. Schizophrenia is diagnosed when it isn't a part of the medication side effects. So things are taken into consideration to make sure someone actually has schizophrenia. So in this image, we can see that somebody, in this red circle at the upper left, somebody with the strong vulnerability or predisposition, meaning there might be a strong genetic factor, biological factor, but they don't experience any stressful life events or any traumas, they can still experience psychosis because the biological component or the part that of it running in the family or being a part of their genetics is so strong, they don't need necessarily to experience a trauma to then have a psychotic episode. And then the bottom figure shows that somebody, even with just a little bit, they still have some predisposition. It's not as strong as the first person. Let's say the first person's mother or father had psychosis. That's pretty strong genetic link, right? So let's say somebody with the weak vulnerability, their parents didn't have psychosis, or they don't really know, maybe further way back, an aunt had it, an uncle had schizophrenia. Maybe it's a little bit further back, but they experience a lot of stress. They experience a very traumatic event. This can also trigger a psychotic episode. Okay. So we've got two examples of people where the biological component part and the stress part may be different, but it can still lead to a psychotic episode. So what increases the risk of psychosis? I mentioned the genetic predisposition. So having a family history of psychotic disorders or things like schizophrenia, bipolar disorder, those things can increase the risk of somebody that later on experiencing a psychotic episode. When there are high levels of stress, whether it's due to traumas or major life changes or ongoing stressors, those things can trigger psychotic symptoms in people who are vulnerable to it with the genetic predisposition. Do y'all remember what was going on with Daniel that was stressing him out? It was the school staff, right? He is, he's starting college and it's a stressful transition in time, and he's also living away from home. Maybe that might have been difficult too, to not have family support around. So those are stressful situations. Those are normal experiences that a lot of people can go through, but they can still be very stressful. Substance use can be a risk to developing a psychotic episode. Certain drugs like cannabis, cocaine, amphetamines, and hallucinogens, those can start or trigger psychosis, or they can make any existing symptoms. Let's say someone already is having psychotic symptoms, it can make their symptoms worse in people who are already experiencing them. There's also sleep deprivation, which I mentioned. So the lack of good sleep or disrupted sleep, interrupted sleep, can worsen the psychotic symptoms, or they can trigger an episode in someone who's vulnerable. There are certain medical conditions like brain tumors, epilepsy, autoimmune disorders, and other degenerative diseases. They can lead to psychosis as a symptom. All right. We were talking about some of the dementias and Alzheimer's disease and Parkinson's disease. I'm sorry. There are also hormonal changes that can trigger a psychotic episode. So changes in hormones like those that happen during puberty and pregnancy or menopause can sometimes trigger psychotic episodes in people who are vulnerable. Trauma, whether it's physical or emotional trauma, including things like childhood trauma or recent traumatic events, can increase the risk of developing psychosis. And lastly, social isolation, feeling lonely, having social withdrawal or lack of social support can contribute to developing psychosis or can make it worse. It's essential, it's really important to know that these factors can increase the risk of someone having psychosis, but not everyone who is exposed to these triggers will develop psychotic symptoms, right? We've all many people have used substances and do not develop a psychotic episode. Many people have gone through high levels of stress and do not develop a psychotic episode. So it's important to know these things increase the risk, but they don't guarantee that somebody will develop a psychotic episode. So what happens after a first episode? An episode of psychosis is treatable, like we mentioned, and it's possible to fully recover. The thing is about, it's important to get help early. So people who do get help soon, as early as possible, 25% will never have an episode again. And 50% may have more than one episode in their lives, but they will be able to live normal lives. Some people who develop psychosis may need ongoing support and treatment throughout their lives. So get help for your loved one or somebody you know who's experiencing this as soon as possible. Often there's a long delay in getting treatment once the first episode starts. The longer it's left untreated, the more disruption it causes to the person's family, their friends, their school, and their work. Unfortunately, there's a lot of negative myths or stereotypes about mental illness and psychosis. Both of these things have a lot of stigma attached to them, and they're still very common in the community. So people don't get help because they don't want to be thought of as crazy, right? A lot of stigma. So other problems can happen or can intensify if someone doesn't get help treatment early, like problems like unemployment, depression, substance use can get worse. Breaking the law and self-injury can happen or get worse. And delays in treatment make it less likely that someone experiences complete recovery. If it's detected and treated early, many problems can be prevented, right? And there will be a lower risk of relapse, a reduced risk of suicide, less disruption in work and school attendance, better social skills maintained, a decreased need for hospitalization, faster recovery, and less disruption and distress for the family. Okay. Many people have also a negative stereotype and belief that people who experience psychosis are dangerous and are going to harm other people. And the reality is that they're more likely to harm themselves. So there's a high risk of suicide when someone is experiencing psychosis. So helping a loved one or helping somebody you know going through psychosis requires you to recognize the signs and symptoms. Okay. Be curious. So ask questions to help people open up about what their experiences with psychosis have been. Like, what are the things that they're seeing and hearing? What are the thoughts that they're having? What the beliefs are that they're having and how they feel? Validate and empathize with them. And it's really important to avoid criticism and hostility or anger, because that can make things worse. It can also increase the risk of relapse after someone has already experienced a first episode of psychosis. What research shows is that people who go back to households where their family shows a lot of criticism about the consequences of the psychosis, or the person's lack of motivation, or that they're not able to do things like they used to, that all of that criticism and hostility can lead to hospitalizations and relapse in the future. It can actually make things worse. It also requires us to work on a shared goal with the person. Can we agree or come up with an agreement with them to go consult with a doctor about their problem, to get an evaluation, and to maybe in the hopes of helping them feel less scared, right? And help them access the treatment. Now, if someone is expressing a real threat to themselves or to someone else, meaning, they are going to harm themselves, they have the way, they are threatening to do it, it's very clear that they will if they don't get help, then call 911, right? The treatment that is recommended for psychosis is called coordinated specialty care. Now, what this means is that there's going to be a care team. There's going to be many different people involved that are going to help with different aspects of the treatment. One of them is medication management. And this can be facilitated by a psychiatrist, a nurse practitioner, or a physician assistant. So they can help understand or assess the medication needs, develop a medication treatment plan, monitor the symptoms, monitor the side effects of the medications, and monitor just the overall person's physical health, right? And another component is family education and support. And this is usually facilitated by someone like a social worker. They can cover topics like psychosis, what is it? What are the medications? How do they work? Coping with stress, reducing relapse, and communicating better as a family. Another important component is individual counseling or therapy about psychosis. Therapists can help the individual understand what it is, what is psychosis, and work towards goals. They can teach them strategies and skills to cope with it. And cognitive behavioral therapy can be used to treat psychosis. Cognitive behavioral therapy means they're helping the individual understand the connection between their thoughts, their feelings, and their behaviors. And they can cover topics like anxiety, depression, social skills, past trauma, and drug and alcohol use. So they can help the individual manage all those other things too. Another important component is employment and education support by a support specialist to help them focus on going back to work and going back to school, and using the support of a coach to help them achieve their goals. There's also case management or access to it. People will need maybe some assistance with basic needs like medical care, managing their money, transportation, housing. Those are needs that can be met by a case manager. And then another component is peer recovery services, or having the opportunity to meet with others who have also experienced psychosis through peer support programs. So being able to relate to people who have shared experiences and who have recovered or in recovery can be very helpful to someone who's just experienced first episode psychosis. Okay, so a lot of different components, and again, different care team members that are a part of the treatment. This coordinated specialty care model for first episode psychosis is available for people ages 15 to 30 who have had a psychotic episode within the last 2 years. So what you do is you call your local mental health authority, or if you don't know what their number is, you call 211 to get, their number to get connected. The one that you have in Laredo is the Border Region Behavioral Health Center. They have a first episode psychosis hotline that you can call to coordinate care if you have a loved one or know somebody who's experiencing psychotic symptoms. And they can help get the coordinated specialty care that is needed for this person. So to kind of wrap up, I've got some resources here that can also be helpful for family members or teachers or counselors, for staff who have somebody in their lives who might be experiencing psychotic symptoms, or who want to learn more, who want to connect somebody to resources. So there's a young adult helpline, and you can give these individuals a number to call. They can also text friend to a number. They can email, and they can chat online. So there are lots of ways to get these young individuals connected to somebody they want to ask questions or talk about their experiences. And there's also the suicide and crisis hotline. So this is not just a suicide number. It is a crisis hotline as well. So it doesn't have to mean that someone has to be experiencing suicide or thoughts of hurting themselves in order to use the suicide and crisis hotline. It can also be helpful for other types of situations, like maybe the one, maybe before Danielle's roommate, was concerned, he could, call the suicide and crisis hotline. And the key takeaways I hope you get from this presentation is that recovery is possible for psychosis, that you can help recognize the signs and the symptoms of an episode of psychosis, get the right treatment. So what does that treatment look like for an individual going through a first episode psychosis? And the importance of early intervention to ensure full recovery and to reduce the risk of future episodes for an individual. So I want to open it up to any additional questions that you all might have about the information that was presented today, or any other questions. Happy to answer them. You can feel free to unmute yourself or put them in the chat.
I have a question.
Hi, Janice.
Can
Yes.
psychosis happen on a child that has autism at a young age? If the child has Asperger's, can he experience psychosis, let's say at 9, 10, or psychosis will only develop between the ages of 15 and higher?
Oh, the 15 to 30 mark, that was for the services that were provided
Okay.
for the coordinated care. But psychosis it can happen. It's very rare, but there are some cases of it happening in young children. It's just not commonly seen at that age. When it comes to what you're speaking about of like this other diagnosis of autism, autistic children can also have things that might resemble like odd thoughts or beliefs or a magical thinking.
Like the aggression and all that. That's what I was asking. I don't know. I have a child who has Asperger's. That's why I'm curious to wonder if that can happen.
Yeah, I don't know what the rate is of it happening with autism, but it's usually very rare for it to happen in young children. And it's more that we see it happening in the late teens to early 20s. It's not to say that it couldn't. It would just require a good evaluation to
Like a
make,
thorough. Okay.
yeah, that's not what's happening.
Thank you.
Sure. Any other questions?
Well, before we end the session, Dr. Villalobos, we'd like to thank you. And I just have a few announcements for everyone who's on right now. Please make sure you sign in. Counselors, also please sign in. The link is there for you to sign in. We want to make sure that we could reach out to everyone later on with more questions on how to better meet your needs regarding these particular trainings. And the recording, I know there was a question about the recording. The recording takes a couple of days to download and upload into our guidance and counseling